Have you ever wondered about the complexities of widespread musculoskeletal pain and how it's diagnosed? Today, we're taking a deep dive into a condition that embodies this complexity: fibromyalgia. This disorder is characterized by extensive musculoskeletal pain, coupled with fatigue, sleep issues, memory problems, and mood disturbances. The pain is not just a simple ache or discomfort, it's a constant gnawing sensation that can affect any part of the body. It's believed that fibromyalgia affects the way our brain and spinal cord process pain signals, leading to this heightened and often debilitating perception of pain. Unlike other musculoskeletal conditions, fibromyalgia doesn't directly damage the muscles, joints, or tissues, but rather amplifies the sensation of pain due to changes in the brain and spinal cord. Now that we know what fibromyalgia is, let's delve into its symptoms. Imagine having pain all over your body, feeling constantly tired and unable to sleep well. These are some of the primary symptoms of fibromyalgia. Fibromyalgia is a complex disorder, and its primary symptoms can be as diverse as they are debilitating. Let's take a closer look at these symptoms. First and foremost, fibromyalgia patients often experience widespread pain. This isn't just an occasional ache or discomfort. We're talking about a persistent pain that blankets your entire body, making even the simplest tasks a challenge. This pain can be deep, sharp, throbbing, or aching, and it's often accompanied by a heightened sensitivity to touch. Next, we have fatigue. This isn't your everyday tiredness. It's a profound exhaustion that doesn't go away with a good night's sleep. It's the kind of fatigue that can make it difficult to engage in everyday activities, let alone anything more strenuous. Speaking of sleep, it's another area where fibromyalgia makes its mark. Many fibromyalgia patients have difficulty sleeping due to pain, restless leg syndrome, or other sleep disorders. Even when they do manage to get some shut-eye, they often wake up still feeling tired, as if they haven't slept at all. One of the tricky things about these symptoms is that they're not exclusive to fibromyalgia. They can be seen in a host of other conditions, making diagnosis a challenge. But when these symptoms persist, with no apparent cause, a diagnosis of fibromyalgia may be considered. It's important to remember that fibromyalgia isn't a one-size-fits-all condition. The intensity and frequency of these symptoms can vary greatly from person to person and even day to day in the same individual. These symptoms can be debilitating, but the diagnosis doesn't stop there. We'll explore more about this in the upcoming scenes, where we delve into the role of tender points in diagnosing fibromyalgia. Stay tuned. Tender points are a key factor in diagnosing fibromyalgia. But what exactly are they? Tender points, in the context of fibromyalgia, are specific spots on the body that are extraordinarily sensitive to pressure. They're not random, but are found in predictable places, typically around the neck, shoulders, back, hips, arms, and legs. In a clinical setting, doctors will apply gentle pressure to these areas, and if a person experiences pain in response, it suggests fibromyalgia. It's interesting to note that these tender points are different from the generalized, widespread pain that fibromyalgia patients often experience. They are localized and specific, acting almost like a map guiding doctors towards a potential diagnosis. Understanding the role of tender points is crucial in the diagnostic process. It's not about causing pain, but about identifying a pattern that's consistent with fibromyalgia. This method helps healthcare professionals distinguish fibromyalgia from other musculoskeletal conditions, which might not have these specific tender points. With this understanding of tender points, we can now explore the factors contributing to fibromyalgia. Fibromyalgia isn't caused by a single factor. It's a complex condition influenced by genetics, environmental factors, and even our brain's biology. Just as a symphony is made up of many different instruments, each playing their own part, so too is the development and progression of fibromyalgia. Let's begin with genetics. Research suggests that fibromyalgia may run in families, indicating a possible genetic predisposition. This means if your mother, father, or sibling has fibromyalgia, you may be at a higher risk of developing the condition as well. Next, we have neurobiological factors. Fibromyalgia is believed to involve alterations in the way the brain and spinal cord process pain signals. Repeated nerve stimulation causes an increase in certain chemicals in the brain that signal pain. Over time, the brain's pain receptors may become more sensitive, leading to an overreaction to pain signals. Now let's talk about environmental factors. Events such as physical or emotional trauma, surgery, and infections can trigger the onset of fibromyalgia. In some cases, the symptoms gradually accumulate over time without a single triggering event. Additionally, certain demographics are more at risk. Women are diagnosed with fibromyalgia more often than men. The condition typically manifests in middle age, but can occur at any age. Psychological stressors, such as a history of mental health disorders, can also increase the risk of fibromyalgia. The relationship between fibromyalgia and mental health is also significant and worth considering. The bidirectional nature of this relationship reflects how fibromyalgia can lead to anxiety and depression, while these mental health conditions can also exacerbate the physical symptoms of fibromyalgia. It's a complex interplay indeed, and one that underscores the multifaceted nature of this condition. The pain isn't just physical. Fibromyalgia has a deep connection with our mental well-being. This disorder is far more than widespread musculoskeletal pain, fatigue, and sleep disturbances. It also has a profound impact on our mental health. Studies have shown a bidirectional relationship between fibromyalgia and mental health conditions, such as depression and anxiety. This means that not only can the physical pain and discomfort of fibromyalgia lead to mental health challenges, but existing mental health conditions can also exacerbate the symptoms of fibromyalgia. It's a cycle that can be difficult to break. This connection is thought to be due to alterations in the way our brain and spinal cord process pain signals, a key feature of fibromyalgia's pathophysiology. In particular, the heightened pain perception characteristic of fibromyalgia can lead to feelings of anxiety and depression, as individuals struggle to manage their symptoms and their impact on daily life. Conversely, those with pre-existing mental health conditions may find their fibromyalgia symptoms worsen during periods of psychological stress. Now that we've seen the impact of fibromyalgia on mental health, let's look at how it's diagnosed. Diagnosing fibromyalgia isn't straightforward. It involves a comprehensive clinical assessment and specific criteria. To make a diagnosis, doctors rely on two key tools: the Widespread Pain Index and the Symptom Severity Scale. The Widespread Pain Index is a checklist of 19 areas of the body where the patient may have felt pain in the week prior to evaluation. These areas include the left and right sides of the body, above and below the waist, and certain parts of the torso. The Symptom Severity Scale, on the other hand, assesses the level of fatigue, waking unrefreshed, and cognitive symptoms. It also accounts for any additional symptoms such as numbness, dizziness, nausea, or irritable bowel syndrome. For a fibromyalgia diagnosis, a patient must have pain and symptoms that have lasted for at least 3 months. Also, there must be no other underlying condition that could explain these symptoms. This is why it's crucial to rule out other conditions with similar symptoms. Conditions such as hypothyroidism, rheumatoid arthritis, and lupus can mimic fibromyalgia, making it a challenge to diagnose correctly. A thorough medical history, physical examination, and sometimes lab tests are used to rule out these other conditions. But remember, fibromyalgia can coexist with these conditions too. Therefore, a patient could have fibromyalgia and another disorder that doctors must properly identify. The journey to a fibromyalgia diagnosis can be long and frustrating, but understanding the diagnostic criteria can help pave the way for effective treatment. Once diagnosed, managing fibromyalgia involves a multidisciplinary approach. Not just medication, but physical therapy, psychological interventions, and lifestyle changes all play a critical role in managing this complex condition. Living with fibromyalgia is challenging, but there are strategies to manage it. A multidisciplinary approach often yields the best results. Pharmacotherapy, for instance, helps manage pain and improve sleep. Antidepressants and anticonvulsants are commonly used, not just for mood, but also for their ability to influence pain perception. Physical therapy plays a crucial role too. It helps maintain muscle tone, flexibility, and endurance. Regular low-impact exercise like swimming or walking can reduce pain and fatigue while improving mental well-being. Psychological interventions are equally important. Cognitive behavioral therapy, for example, helps individuals understand and change thought patterns, leading to behavior that may exacerbate symptoms. Mindfulness and stress reduction techniques, such as meditation and yoga, can also be beneficial. Patient education and support groups provide a platform to share experiences and coping strategies, often reducing feelings of isolation and helplessness. Remember, it's not about curing fibromyalgia, it's about managing it. While fibromyalgia is a lifelong condition, understanding and managing it effectively can greatly improve quality of life.